Nursing concepts are great. They give us a toolbox of knowledge that we can then apply to different specific diseases. Today, we're going to learn about the concept of immunity, and then we will apply that later to different exemplars. Let's talk about the concept of immunity right now. As we go through this video together, please remember to fill out concept guide version B and study along with me. Remember, the goal of these videos is that you are studying the material and learning about it as we go. And here are the objectives that we want to accomplish by the time you're done with this video. That you'll be able to define and describe the concept of immunity, notice what risk factors put patients at risk for problems with their immune system, recognize when someone does have a problem with immunity, and then what to do about it. What appropriate nursing and collaborative interventions will help a person who has an issue with their immune system. Let's go ahead and get into it right now. So immunity is the normal physiologic response to foreign invaders, things like microorganisms and proteins, and also can be attributed to anything with an inadequate or excessive immune response. So it's how the body responds to foreign invaders and sometimes goes a little too much or too little in that response. So the scope of our concept is we want an optimal immune response, or we're able to fight off foreign invaders, things like proteins from food that we eat, or a bacterial infection or a virus, that we have a good response and we can launch the appropriate attack. But when our body overdoes it and gets a little too excited, we can have an overactive immune response where we get things like autoimmune disorders and hypersensitivities, allergic reactions. And when our body is not giving enough of an immune response, we can have an immunosuppressive state where we have an underactive immune response, and we're at great risk from succumbing to different infections and getting infected easily and getting things like cancer. So either end of the extremes are not good. We want to have a normal functioning immune system. Okay, I want to introduce you here to our immune system starting lineup. The body has an incredible system that helps to regulate attacks against foreign invaders. And so we're going to introduce these starting lineup here for you. So the major histocompatibility complex proteins, MHC1 and MHC2. All you need to know about this is that our body waves, our cells wave little flags to say, this is me, don't kill me, or to communicate with other cells when they did find a foreign invader. So we'll have cells in the body that go around looking for cells that are not waving a self flag. Our body needs the ability to recognize itself from non-self. And that's what these MHC1 and MHC2 do. Now, there are some organs involved in our immune system. First, the bones. In the bone marrow, our B cells are formed. B for bone marrow. It's not very original, is it? But B for bone marrow because the B cells grow up and are formed in the bone marrow of the bones. Our T cells, also part of our immune system, are birthed and grow and mature in the thymus gland. T for T cells for thymus. The thymus is here up in the neck. And that's where our T cells are born. And then we have some filters of the body. Our spleen, the lymph system, our tonsils and appendix all serve as filters for our body, kind of like a coffee filter, to filter out any waste material and other things that we don't want floating around in our system. So we have these filters and we have these nurseries of immune cells in our body: the bone marrow, the thymus gland, and then the spleen, lymph nodes, tonsils, and appendix. Let's talk about our white blood cells. We have three different kinds of white blood cells that we want to talk about: phagocytes, B cells, and T cells. Now, phagocytes are non-specific white blood cells that go around and just look for any cells that are not waving a flag that says, this is me, I am myself, right? And so it doesn't care what it is, but if it doesn't show that it's waving a flag that says we're on the same team, it just eats it up. Kind of like a Pac-Man. It just kind of goes through the body, eating up any foreign invaders without really thinking about it and not being specific. Now, B cells are much more specific. They're the antibody making factories of our body. It helps us to recognize foreign invaders and create antibodies to launch a quick attack against them in the future. And our T cells, those killer T cells, they are the quarterbacks of our immune system. They kind of tell everybody else in the immune system what to do. And they are the ones who can go in and kill off these foreign invaders. So we have both non-specific leukocytes, phagocytes, and specific ones, the B cells and T cells. The B cells and T cells are specifically going to be activated for specific types of invaders. And like I just mentioned, our B cells are antibody factories. Our B cells make these little antibodies that can quickly recognize the same invader in the future, tag those invaders, and so that the phagocytes can quickly sweep them away without them taking over the body. So once we have B cells that can make antibodies for a specific disease, we can get over that disease a lot quicker. So if you think about COVID-19 and getting the vaccine, or even just getting COVID-19, you develop antibodies that float around in your body. And so that if you get that virus again, these little antibodies tag onto the virus, and that cues the rest of the immune system just to take care of it really quickly. So antibodies are an amazing thing. And finally, we have the complement system. Now, if you've ever been to a dinner party where just the host or the hostess is just so good at being the host, they've got candles lit, the music is the perfect volume, and it just sounds so nice. They've got really great cocktails. Everyone's having a great time. It's just a well-paced party, just a really, really nice time. The host is with the mostest, right? The host sets the stage or the whole environment for a party. And that's really what the complement system does. The complement system is your hostess with the mostest that just sets up the whole environment so that the white blood cells and the immune response, everybody can do their job just better. They just set up a better system for the body. So it's just kind of in the background, setting up the ambiance for the immune system. And then we've got our dendritic cells. Now, dendritic cells, you usually think about like in the brain. They're not neuro cells. They're just dendritic cells because they look like dendrites. They've got that kind of star shape to them. Dendritic cells go through the body. They find foreign invaders. They chew them up, and they spit out little parts of them, and they wave parts of that dead virus or bacteria on a little flag. And they run around to the T cells saying, oh, look what I found. When I was growing up, my mom's best friend, they owned a farm. And so us city kids would go out to the country sometimes on the weekend. And they had a cat who was a barn cat, and she was a mouser. And almost every day we would wake up and go to the front porch, and that cat would be delivering a mouse on the porch, a dead mouse, for us to see, oh, look what I found. Here's a gift, right? Look what I killed. And that's what the dendritic cells do. They show up and they've eaten up this virus or bacteria, and they spit out a little part of it onto a flag, and they wave it around, going over to the T cells and saying, look what I killed. And then the T cells can take care of it. But that's our little dendritic cell. Dendritic cells are considered phagocytes, and so they're part of this WBC here. Now we have different types of an immune response, an innate immunity, an active acquired immunity, and a passive acquired immunity. Innate immunity is everything you have when you're born, everything that's present at birth. You have non-specific white cells, phagocytes, that just are the Pac-Man of the body going through non-specifically just attacking foreign invaders. You have your skin to protect you from external infections and foreign invaders. You have the lining of your lungs, and you have your inflammatory response. These are all very non-specific. They're not related to a specific viral attack or bacterial attack. They're just general. That's called your innate immunity. It's what you're born with. Active acquired immunity is when you are exposed to a pathogen and you develop activated T cells and antibodies, so that if you ever get that thing again, you have an immune system that knows it, that has antibodies for it, that remembers it, and can attack very quickly. And then you have your passive acquired immunity. So in passive acquired immunity, you're actually given antibodies. And so it hasn't activated your T cells yet, but you do have the antibodies floating around. So you've seen in COVID-19 that we're giving some patients monoclonal antibodies. So they don't have any activated T cells, but at least they're given some antibodies to float around and tag on to the COVID virus to get their immune system going faster. So let's review. Innate immunity, non-specific Pac-Man, just go through the body without thinking about it. Active immunity means you have activated B and T cells as well as antibodies. Passive immunity is when you have antibodies only, but no activated T cells just yet. So that summarizes the starting lineup of your immune system. For a quick review of how the immune system functions, I want you to head over to this link. I'll put it in the description box below. Watch this quick 6-minute video and then come on back here for the rest. I'll see you in a few minutes. All right, so on either extreme of immunity, we can have problems. We can have either an underactive immune response or an overactive immune response. An underactive immune response can be of some kind of immunodeficiency like HIV or AIDS or cancer, or it can be immunodeficiency because we've given them some kind of medication that makes them immunosuppressed. For example, chemo drugs, steroids, immunomodulators, all of these drugs suppress the immune system, and that's considered secondary immunodeficiency. Now, on the flip side, we can have our overactive, overzealous immune system that takes over. And we're going to break this down into the 4 different types of hypersensitivities in an exaggerated immune response. And in these exaggerated immune responses, you can have both localized effects as well as systemic. Here are the 4 types of hypersensitivities. This is the overactive immune system. Type 1 is IgE mediated. So this is when your histamine response kicks in and you see seasonal allergies and maybe even anaphylaxis to like a peanut allergy, for example. It happens very quickly and it can lead to localized effects like redness around a bee sting, or systemic effects like the throat closing or hypotension or tachycardia. Type 2 is a cytotoxic effect, and this is, we're going to most likely see this with like a blood transfusion reaction where it starts attacking our cells. A type 3 is when clusters of the antibodies build up and cause damage into the tissue. The most common examples of this is going to be lupus or rheumatoid arthritis. And then type 4 reactions is when those T cells actually start attacking our own cells. And so remember, we're supposed to recognize our own cells. We're supposed to recognize self. That's part of a healthy immune system. These T cells are not recognizing self, and they start attacking the body's own cells with the T cell reaction. Examples of this is going to be Crohn's or multiple sclerosis. Now, when our body has an underactive immune response, this can cause a variety of things, like infections, because we don't have the ability to fight it off. It can be bacterial, fungal, or viral. And we can also get cancers. So remember, our body is always making new cells. And sometimes those cells aren't, they can be mutated. They're not good. They're not normal. And we don't want those in our body. And usually our cells are really good about waving a little flag to say, I'm damaged, kill me, just kill me now. I'm not good for the team. I'm going to cause too much damage for our body. Just get rid of me. And then the phagocytes come through and eat it up. But with cancer, sometimes they stop waving these flags and get sneaky, and then they start morphing into tumor cells. And so if we don't take care of these mutated cells, that they can grow and cause cancer. So these are consequences when our immune system response is underactive. Okay, and with an exaggerated immune response, an overactive immune response, we can have local or systemic effects, rashes, arthralgias, and we can see inflammation, which leads to lack of function and tissue damage. So we can see damage to how organs function. We can see damage to joint spaces, fatigue, malaise, and so on. So let's talk about patients who are at risk for immune function disorder. Now, The very young are at risk for immune function disorder because they don't have that active or passive immunity yet. They'll start getting vaccinations around 6 weeks old, but they don't have any immunity when they're first born other than their innate immunity. So they're at high risk to get infections. And then the very old, because their immune system is worn down and tired and does not respond as quickly, nor does it have the same antibody response as a younger person. The non-immunized are at high risk for infections because they don't have that active or passive immunity with the antibodies ready to fight off infections. Different environmental factors, nutrition, exposure to pollutants like smoking, or unsanitary conditions can impact being invaded by foreign invaders. Chronic illness can cause difficulty fighting off immune system issues, either making it difficult to fight off new infections or making your body overactive to those infections. Immunosuppressant medications, chemo, organ transplant patients, people on steroids, medications for autoimmune disorders. All of these types of patients have medications that are immunosuppressives. And so when their body gets sick, they don't have the ability to fight it off. High-risk behaviors and substance abuse can increase the risk for HIV specifically, and pregnancy can cause a risk for worsening symptoms with immune disorders. So what symptoms are you going to notice if a patient has altered immunity? Well, first thing you're going to do is take a good medical history, looking for personal and familial family history. Knowing about their vaccination status, any current medications they're on that may contribute to weakening their immune system. Getting to know any allergies they're on. This is why we check allergies every time we talk to a patient and give them meds, because they could have an allergic reaction. We want to talk about their lifestyle behaviors that could put them at higher risk for things like HIV or AIDS. Talking about their occupation, and does that put them at higher risk? And then also their social environment. So now someone who has a suppressed immune function, someone whose immune function is suboptimal, they're going to report frequent infections, poor wound healing, fatigue, malaise, weight loss. They may appear malnourished. They may have chronic wounds, enlarged lymph nodes, or the presence of opportunistic infections like tuberculosis or syphilis that are easier for their bodies to succumb to because their immune system is weakened. And on the flip side, someone who has an overactive and exaggerated immune system, we're going to see allergic symptoms, pain, fatigue, or fever. They may have a mild allergic reaction. So if you're allergic to cats and you go pet a cat and then you've got, your eyes are watery and red and maybe your nose is a little sniffly, well, that's a pretty mild reaction. If you're allergic to peanuts and they have peanuts in your pad thai that night, your throat starts closing, you drop your blood pressure, and you go into anaphylactic shock. Well, that's a very severe allergic reaction. So allergic reactions can really run on a spectrum. And then we can see autoimmune disorders where the body starts attacking itself because it has an overactive immune response. Diagnostic tests can include a CBC, ANA titers to test for antibodies against their own body. A C-reactive protein and an ESR are both nonspecific markers of inflammation that can not tell us why, but can tell us that there is inflammation present in the body. We can do allergy skin testing or genetic testing to look for any predispositions. Rheumatoid factors give us a clue as to whether or not a patient has rheumatoid arthritis. And there are other antibody tests that we can do to test for antibodies against their own body, or organ function tests to look for any organ dysfunction from the body attacking itself. Let's talk about collaborative interventions as it pertains to immunity. The primary thing we want to do is prevent this from happening in the first place. So we can prevent issues with the immune system by making sure patients have their immunizations so that they are not going to succumb to foreign invaders and they have a nice, strong immune response. We're going to encourage avoiding high-risk behaviors, not sharing needles if they are drug users, and using condoms for sexual practices. We're going to encourage adequate nutrition so that our body has strength and energy and vitamins to fight off foreign invaders. encouraging good rest and exercise and all those healthy habits, as well as infection control methods to prevent infection from happening in the first place. Prevention is always the name of the game. So if we can avoid the infection, that's always a good place to start. Now, there's no general screenings we're going to do overall for the general population. But for patients who are at high risk for HIV, then regular screenings are going to be recommended. Now, collaborative interventions are really going to depend on which side of the spectrum we're talking about. Do they have an immune compromise, or do they have an overactive immune system? So if they have an immune compromise where their system does not function as much as it should have, we're going to treat infections and treat them aggressively. We're going to treat any GI symptoms that they might get, like diarrhea or fluid and electrolyte loss. They can also get yeast infections really easily, those opportunistic infections, because their body just doesn't have the capacity to fight things off. They can have skin disorders, which would need to be treated. And we would want to encourage optimal nutrition, vitamins, and supplements like Ensure, and making sure that they're maintaining a healthy weight. And on the flip side, if they have an overactive, way too aggressive immune system, if they have an anaphylactic response, which is a type 1 response, hypersensitivity, we're going to give them an EpiPen, support their airway, breathing, circulation, treating the hypotension, and giving bronchodilators to open up their airway. And of course, those patients need to be rushed to an emergency room right away. Patients with autoimmune disorders with a chronically overactive immune system may need to be on immunosuppressive therapy to cool off their immune system and slow their roll. So we can treat them with steroids, with chemo, with NSAIDs or immunomodulators to try to chill out their immune system that's just going crazy. And these exaggerated immune responses can cause pain, and so we're going to evaluate and treat that as appropriate. Here are the related interrelated concepts as it pertains to immunity. Here are some examples of immune system issues: HIV, allergic rhinitis, lupus, diabetes, multiple sclerosis, Crohn's, rheumatoid arthritis. These all fall into this category of an immune system issue, either immunosuppressed or immuno-overreactive. And so once we have an understanding of immunity as a concept, we can apply what we know to these specific exemplars. And that's going to wrap it up on this nursing concept of immunity. As always, thanks for studying with me today, and I'll see you next time.